Describe a situation where you had to deal with an angry patient or colleagues.
In my nursing career, I've encountered situations requiring skillful management of anger, both from patients and colleagues. One instance that stands out involved a post-operative patient, Mrs. Eleanor Vance, who became increasingly agitated and verbally aggressive towards nursing staff due to uncontrolled pain despite regular analgesia. She was shouting and demanding stronger medication, disrupting the ward environment on the orthopedic post-operative ward and causing distress to other patients, particularly in the 4-bed bay. My initial response was to approach Mrs. Vance calmly and privately, removing her from the busier ward area to a quieter patient room designated for consultations. I actively listened to her concerns, allowing her to express her frustration about the ongoing pain in her hip post-arthroplasty without interruption, acknowledging her pain and validating her feelings that her current pain level was unacceptable. While empathizing with her discomfort, I also calmly and clearly explained the current pain management plan, detailing the medications she had received, regular paracetamol and ibuprofen, and PRN oral morphine, and the rationale for the prescribed dosages, emphasizing the importance of multimodal analgesia in post-operative recovery, while assuring her I would advocate for her with the medical team. I then promptly contacted the on-call orthopedic registrar to communicate Mrs. Vance's escalating pain and distress. Following medical review, an adjusted pain management strategy was implemented, which included the addition of regularly scheduled oxycodone and a PCA pump if needed, and I diligently reassessed Mrs. Vance's comfort level every hour for the next few hours, communicating the changes in the plan and expected improvements to her directly and frequently, explaining how the PCA pump would allow her more control. Throughout this process, I maintained a calm and professional demeanor, consistently focusing on understanding and addressing the root cause of her anger, her uncontrolled pain, and working collaboratively with the medical team to find a solution. Ultimately, by actively listening, advocating for the patient, and maintaining open communication, we were able to effectively de-escalate the situation, improve Mrs. Vance's pain control, and restore a calm environment on the ward, which greatly improved the atmosphere for patients recovering from hip and knee replacements. This experience reinforced for me the importance of empathy, active listening, and proactive problem-solving when managing anger in the healthcare setting.
If I walked onto a ward where you were working, how would I be able to tell that the patients you were allocated were being cared for?
If you were to walk onto a ward where I was working and observe my allocated patients, I believe several indicators would clearly demonstrate that they were receiving diligent and comprehensive care. Firstly, you would observe a calm and organized environment around each patient, particularly important on a busy surgical ward like the vascular surgery unit. Their immediate bedside areas would be tidy and clutter-free, with essential equipment like 4 pumps and oxygen readily accessible and in good working order, reflecting proactive organization to facilitate efficient care delivery. Secondly, you would notice patients appearing comfortable and engaged, where appropriate to their postoperative status. This might manifest as patients being positioned comfortably, with pressure-relieving mattresses and pillows in place, with readily accessible call bells and personal items like reading glasses and water jugs within reach. For patients who are alert and communicative, such as those recovering from elective hernia repairs, you might observe nurses engaging in conversations, explaining post-discharge wound care plans or reviewing their mobility goals for the day, or simply offering a reassuring presence, indicating a focus on holistic well-being beyond just task completion. You would also likely see evidence of proactive monitoring and assessment, charts being updated in real time with regular vital sign recordings, infusion pumps programmed and checked with current infusion rates documented clearly, and nurses attentively observing patient wound sites during dressing changes or assessing peripheral pulses post-vascular bypass surgery, demonstrating vigilance in tracking patient status. Furthermore, you would hopefully sense a respectful and dignified atmosphere in interactions between myself and patients, particularly important for patients who may be feeling vulnerable post-surgery, perhaps after a bowel resection. Communication would be clear, considerate, and tailored to individual patient needs, respecting their privacy with screens used appropriately during personal care and autonomy throughout all care activities. In essence, you would observe a blend of organized efficiency, proactive monitoring, patient comfort, and respectful communication, collectively indicating a standard of care that prioritizes both clinical excellence and patient well-being on a surgical ward focused on complex post-operative recovery.
How can you ensure good practice is maintained on your ward?
Ensuring good practice is consistently maintained on a ward, particularly in a specialized area like the cardiothoracic surgical ward, requires a multifaceted and proactive approach, encompassing both individual accountability and collective responsibility. A cornerstone of maintaining good practice is rigorous adherence to established hospital policies, protocols, and evidence-based guidelines, such as those for postoperative infection prevention and deep vein thrombosis prophylaxis. This involves a personal commitment to staying updated on current best practices, often disseminated through unit-based in-services and hospital-wide clinical updates, and consistently implementing them in daily nursing care, such as correctly applying compression stockings and administering subcutaneous heparin as per protocol. Furthermore, actively participating in regular ward-based audits and quality improvement initiatives, for instance, audits of surgical site infection rates or medication administration accuracy, is crucial. By proactively monitoring key indicators of care quality, such as postoperative pneumonia rates or compliance with early mobilization protocols for cardiac surgery patients, and engaging in root cause analysis when deviations occur, we can identify areas for improvement and implement targeted interventions to enhance practice. Promoting a culture of open communication and peer support within the ward team is also essential, especially in a high-stress environment like the surgical ward. This involves creating an environment where staff feel comfortable raising concerns about potential deviations from best practice, like incorrect surgical counts, asking questions about new surgical techniques, and providing constructive feedback to one another without fear of reprisal, fostering a collective commitment to upholding high standards of care, particularly in relation to patient safety in the operating theater and postoperative care. Actively engaging in regular professional development and continuing education, such as attending surgical nursing conferences or completing online modules on advanced wound care, is also vital for every nurse on the ward. This ensures that our knowledge and skills remain current and aligned with evolving best practices in surgical nursing care, and that we are equipped to deliver the most up-to-date and effective care to patients undergoing complex surgical procedures. Finally, effective leadership and role modeling from senior nurses and ward managers, such as the surgical ward nurse manager and clinical nurse specialist, are paramount in setting the tone for good practice. By consistently demonstrating exemplary clinical skills, upholding professional standards, and actively promoting a culture of safety and quality, senior staff can inspire and guide the entire team in maintaining and continuously improving ward practices, specifically related to surgical patient care and recovery. In essence, a combination of individual responsibility, proactive quality monitoring, open communication, continuous learning, and strong leadership are all integral to fostering and sustaining a culture of good practice on the ward, particularly in the demanding and specialized setting of surgical nursing.
How do you feel when a colleague or patient holds an opinion which differs from your own?
When a colleague or patient holds an opinion that differs from my own, especially in the context of surgical nursing where decisions can be complex and have significant implications, I view it primarily as an opportunity for learning and a chance to broaden my perspective. I understand that diversity of opinion is inherent in any collaborative environment and especially within healthcare, where individual patient needs, cultural backgrounds, and values are paramount. Therefore, my initial feeling is usually one of intellectual curiosity, prompting me to understand the rationale behind their differing viewpoint, especially if it pertains to patient care decisions post-operatively. I believe that respectful dialogue and considering alternative perspectives are essential for both professional growth as a surgical nurse and for providing truly patient-centered care in the complex surgical environment. It's through these differing opinions that we can challenge our own assumptions about surgical best practices, patient preferences, or optimal care pathways, identify potential biases we might hold, and ultimately arrive at more well-rounded and effective approaches to patient care. I recognize that my opinion, even with my 7 years of surgical nursing experience, is just one perspective, and while I value my own clinical judgment and experience, I also deeply value the insights and experiences of others, whether they be fellow surgical nurses, surgeons, anesthetists, or, most importantly, the patients we serve recovering from major surgical interventions. Therefore, differing opinions, when approached with openness and respect, are not a source of conflict for me in the surgical ward setting, but rather valuable contributions to a richer and more comprehensive understanding of a situation and the optimal path forward for each individual patient.
Can you tell me about a time that this has happened?
Yes, I can recall a specific instance where a colleague and I held differing opinions regarding a patient's preoperative bowel preparation regimen before elective colorectal surgery. The patient, Mr. David Chen, who was scheduled for a laparoscopic sigmoid colectomy, and while I felt that a more aggressive bowel preparation, including both oral laxatives and enemas the day before surgery, was warranted to ensure optimal bowel cleansing and minimize surgical site infection risk, my colleague, a very experienced surgical nurse who had worked on the colorectal team for many years, believed in a more streamlined approach, advocating for oral laxatives alone, citing recent evidence suggesting that overly aggressive bowel prep could be detrimental and lead to dehydration and electrolyte imbalance, particularly in elderly patients like Mr. Chen, who was 78 years old. Our differing opinions stemmed from our individual interpretations of evolving evidence-based practice in bowel preparation and perhaps slightly varied risk assessments for this specific patient. I lean towards maximizing bowel cleanliness to reduce infection risk, while my colleague prioritized minimizing patient discomfort and potential complications associated with aggressive bowel prep, especially in older individuals.
How did you deal with the situation?
To address this difference in opinion regarding Mr. Chen's preoperative bowel preparation, I initiated a respectful and evidence-based discussion with my colleague, focusing entirely on the patient's safety and the current best practice guidelines for colorectal surgery bowel preparation. I started by clearly articulating my rationale for advocating for a more comprehensive bowel prep, referencing older, established surgical literature emphasizing the link between bowel cleanliness and surgical site infection prevention in colorectal surgery, and my understanding of the surgeon's usual preference on our unit. Crucially, I then actively listened to my colleague's perspective, seeking to understand her reasoning for favoring the streamlined approach and acknowledging her extensive experience on the colorectal surgical team and her awareness of more recent studies questioning the benefit of aggressive bowel prep and highlighting potential harms, particularly in the elderly. She shared her understanding of updated hospital guidelines that were leaning towards less aggressive regimens based on this newer evidence. Recognizing the validity in both our viewpoints and acknowledging the evolving nature of best practice in this area, we agreed to collaboratively review the most recent hospital bowel preparation protocol together, accessing the electronic policy database and critically appraising the current recommendations based on the latest evidence. We then jointly presented our findings, including the slightly nuanced hospital policy that allowed for some clinical judgment based on patient factors, and our individual rationales to the surgical consultant on call, clearly outlining the patient's specific characteristics, including his age and comorbidities, and our slightly different perspectives on the optimal bowel prep strategy in this case. The surgical consultant, appreciating our proactive and collaborative approach and considering both our input and the updated hospital guidelines, ultimately decided to opt for the streamlined bowel preparation with oral laxatives only, but emphasized the importance of excellent intraoperative bowel handling and surgical technique to minimize infection risk, and also ordered preoperative intravenous hydration to mitigate any dehydration risks in Mr. Chen. Following this decision, we both ensured the streamlined bowel prep was implemented correctly, monitored Mr. Chen for any signs of dehydration or electrolyte imbalance, and communicated effectively with each other and the surgical team throughout his perioperative journey to ensure optimal patient safety and surgical outcomes. This situation highlighted to me the vital importance of staying current with evolving evidence-based practice in surgical nursing, the value of respectful dialogue and evidence-based discussion when navigating differing professional opinions, and the necessity of patient-centered decision-making, taking into account individual patient factors and the most up-to-date clinical guidelines. By focusing on the patient's best interests and engaging in open, evidence-informed communication, we were able to reconcile our differing approaches and ultimately contribute to delivering appropriate and safe preoperative care for Mr. Chen.
In the event of the death of a patient, how would you manage this situation?
In the event of a patient's death, particularly in the often emotionally charged environment of a surgical ward like the surgical oncology unit, my management would prioritize providing compassionate and dignified care for the deceased patient and offering sensitive and supportive care to the family and loved ones, while also ensuring appropriate post-mortem procedures are followed with respect and efficiency and supporting my colleagues who may also be deeply affected. Immediately following confirmation of death by the medical team, for instance after a prolonged and challenging postoperative period following a major Whipple's procedure for pancreatic cancer, my first action would be to ensure the patient, perhaps Mrs. Isabella Rossi, is treated with utmost respect and dignity. This involves preparing the body according to hospital protocols and cultural sensitivities, ensuring a respectful post-mortem care process including removing lines and tubes, gentle cleansing, and appropriate shrouding, providing privacy and a peaceful environment in the immediate aftermath, perhaps by dimming the lights in the room and minimizing noise outside. Simultaneously, I would prioritize sensitive and timely communication with Mrs. Rossi's family, who have been vigilantly at her bedside for the past few days. This communication should be delivered in a private and quiet setting, such as the ward bereavement room, with empathy and compassion, providing clear and honest information about Mrs. Rossi's peaceful passing. I would allow the family time and space to grieve, actively listening to their needs and offering emotional support, perhaps offering tissues and a quiet presence, while also providing practical information regarding next steps, such as contacting clergy if requested or arranging funeral services and informing them about hospital bereavement resources like the social work department and grief counseling services. Furthermore, I would ensure all necessary post-mortem care and documentation are completed meticulously and respectfully, following all legal and hospital guidelines for death certification, release of the body to the hospital mortuary, and careful handling of personal belongings, ensuring they are catalogued and prepared for handover to the family with sensitivity. This includes accurate and timely completion of all required paperwork, such as the death notification form and handover documentation for the mortuary, and ensuring respectful transfer of the deceased to the appropriate location. In addition to caring for the patient and family, I would also attend to the needs of the ward team, particularly the nurses who have been providing intense care for Mrs. Rossi over the past weeks and may be feeling the emotional impact of her passing, and perhaps the junior surgical doctors who were closely involved in her care. The death of a patient, especially one who has been under our care for a prolonged period, can be emotionally impactful for staff, and providing a supportive environment for colleagues to process their emotions is vital. This might involve offering a brief debriefing session for the team, providing a space for quiet reflection in the staff room, and ensuring team members have access to appropriate support services like employee assistance programs or peer support groups if needed. In essence, my approach to managing patient death, especially in the complex and often emotionally taxing surgical environment, is guided by unwavering principles of compassion, dignity, respect, and adherence to protocol, comprehensively encompassing the needs of the deceased patient, their grieving family, and the often affected healthcare team.
How do you ensure that you maintain good working relationships with your senior colleagues?
Maintaining positive working relationships with senior colleagues, such as surgical consultants, senior registrars, and the ward's nurse unit manager, is essential for effective teamwork, optimal patient care, and a harmonious ward environment, particularly on a busy surgical ward like the trauma and emergency surgery unit. My approach focuses on proactive communication, consistent demonstration of respect for their extensive experience and leadership, and a collaborative spirit in all interactions. Firstly, I prioritize clear, concise, and respectful communication in all interactions, especially in the fast-paced surgical setting. This involves providing timely and accurate updates on patient status, ensuring my patient handovers are thorough and focused, seeking clarification promptly when unsure of surgical orders or protocols, and communicating any concerns or potential issues proactively and professionally, always using SBR communication techniques for structured and efficient information exchange. I ensure my communication is always respectful of their very demanding time and workload, being concise and focused in my interactions, and using pagers and phone calls judiciously and only for essential matters. Secondly, I consistently demonstrate deep respect for their vast surgical expertise and leadership within the surgical team. I actively and attentively listen to their guidance and advice during ward rounds, post-operative reviews, and surgical planning meetings, recognizing their wealth of clinical knowledge and surgical expertise honed over many years of practice. When seeking input or making suggestions, I do so respectfully, acknowledging their senior role and framing my contributions as collaborative efforts to enhance patient care and improve surgical outcomes, ensuring my suggestions are always evidence-based and patient-focused. Furthermore, I aim to be a reliable, proactive, and supportive team member, consistently demonstrating a willingness to contribute to the smooth running of the ward and ease the workload for senior colleagues whenever possible. This includes being flexible and adaptable when surgical priorities shift suddenly, readily assisting colleagues, including senior doctors, with tasks when needed, and proactively seeking out opportunities to take initiative and contribute positively to the team's goals, for instance by preparing complex discharge summaries or proactively coordinating equipment for upcoming surgical procedures. I also value actively seeking constructive feedback from senior colleagues and consistently acting upon it to improve my surgical nursing practice. This demonstrates a commitment to continuous professional development and a genuine willingness to learn and grow from their extensive surgical experience and mentorship. Finally, consistently fostering a positive, professional, and courteous demeanor in all interactions, even during stressful periods in the or during demanding post-operative patient management, contributes significantly to building and maintaining good working relationships. Maintaining a respectful, courteous, and collaborative attitude, even in challenging high-pressure surgical situations, helps build trust and strong rapport with senior colleagues over time, fostering a cohesive and high-performing surgical team. In essence, my strategy for maintaining good working relationships with senior surgical colleagues is firmly based on proactive, respectful, and concise communication, consistent demonstration of respect for their expertise and leadership, a genuinely collaborative approach to patient care, a proactive willingness to learn and improve, and a consistently professional and courteous attitude, all essential elements for success in a demanding surgical environment.
What measures will you put in place if a patient is anxious and wants to be visited by family when there are currently no visitors allowed in the hospital?
If a patient, such as an elderly patient recovering from hip surgery who is feeling particularly lonely and isolated, were to become anxious and express a strong desire for family visits when hospital visitor restrictions are in place due to a recent local surge in respiratory infections, my priority would be to acknowledge and validate their anxiety and explore all possible avenues to safely facilitate connection with their family while rigorously adhering to hospital policy and strict infection control guidelines, especially on the post-operative ward. Firstly, I would listen empathetically to the patient's concerns, acknowledging their anxiety and distress at being separated from family, particularly during their post-operative recovery, validating their feelings of loneliness and isolation and explaining the rationale behind the visitor restrictions in a clear and compassionate manner, emphasizing patient safety and the need to protect vulnerable post-surgical patients from potential infection exposure as the primary drivers for the policy. I would then explore alternative methods of connection with the patient and their family, proactively offering practical solutions to bridge the communication gap. This would include proactively facilitating virtual visits using the ward's dedicated tablet devices or assisting the family in setting up video calls on their personal smartphones, ensuring both the patient and family are comfortable with the technology and assisting with setup and providing any necessary technical support if needed. If virtual visits are not sufficient to alleviate the patient's distress, I would investigate the possibility of limited, exceptions-based visits depending on University Medical Center's current visitor policy and the specific extenuating circumstances. This might involve liaising with the ward manager or infection control team to explore options for compassionate exceptions, particularly for patients who are very distressed, cognitively impaired and struggling with disorientation due to lack of familiar faces, palliative, or facing significant emotional challenges due to the prolonged visitor restrictions. If a limited visit is deemed possible and approved as a compassionate exception, I would meticulously ensure strict adherence to all infection control measures, emphasizing to the family the absolute necessity of pre-screening visitors for symptoms, strictly limiting visit duration to a short period and the number of visitors to one designated family member only, ensuring mandatory and correct mask wearing throughout the visit and scrupulous hand hygiene before and after, and designating a safe visiting area, perhaps the patient's private room or a designated area away from other patients, to minimize any potential infection risk to other vulnerable post-surgical patients on the ward. Furthermore, to supplement the limited family connection and address the patient's anxiety, I would enhance my own nursing presence and support for the patient to actively mitigate their feelings of isolation and anxiety during this visitor restriction period. This might involve intentionally spending extra time with the patient during my shift, offering frequent reassurance and emotional support, proactively engaging in conversation beyond just clinical tasks, and providing diversional activities such as reading aloud, listening to music, or assisting with simple cognitive stimulation activities to alleviate loneliness and boredom in the absence of family visits. I would also ensure the patient is aware of and has access to other hospital support services, such as the hospital chaplaincy for spiritual support or the volunteer patient companionship program, if their anxiety and emotional distress are significant and require additional resources. In essence, my comprehensive approach would be to carefully and compassionately balance the patient's very real emotional and social needs with the absolutely critical need for stringent infection prevention and adherence to hospital policy during visitor restrictions, exploring all safe and policy-compliant avenues to facilitate some form of family connection, however limited, while simultaneously maximizing my own supportive nursing presence and diligently utilizing available hospital resources to effectively alleviate the patient's anxiety and feelings of isolation during a challenging time.
What would you do if a family member is constantly coming up to you for questions and is disrupting your planned work activities?
If a family member, such as Mrs. Rodriguez, the daughter of a patient recovering from a complex liver resection, were to frequently approach me with questions, understandably seeking detailed information about her father's post-operative progress and prognosis, but in doing so was consistently disrupting my planned work activities on the busy hepatobiliary surgical ward and potentially impacting my ability to efficiently attend to other patients also requiring complex post-operative care, my response would prioritize skillfully balancing compassionate and empathetic communication with Mrs. Rodriguez with the absolute need for effective time management and ensuring equitable and safe delivery of care for all my assigned patients on the ward. Firstly, I would acknowledge Mrs. Rodriguez's understandable anxiety and very valid desire for frequent and detailed information about her father's condition with empathy, patience, and a professional demeanor. Recognizing that her repeated questions and anxious approaches likely stem from deep concern and love for her seriously ill father post-major surgery, I would start by reaffirming my complete commitment to providing regular updates to her and answering all of her questions thoroughly and transparently, but also gently explaining my responsibility to ensure all patients under my care receive timely and attentive nursing, especially on a high-acuity surgical ward. I would then proactively establish a structured and mutually agreed-upon communication plan with Mrs. Rodriguez to effectively manage her very understandable need for information without inadvertently disrupting the crucial ongoing care delivery to all patients on the surgical ward. This might involve scheduling a designated time each day, perhaps after my initial morning medication round and patient assessments are complete, or during a quieter period mid-morning before surgical procedures begin, to provide Mrs. Rodriguez with a comprehensive and uninterrupted update on her father's condition, reviewing his overnight progress, current vital signs, any changes in his surgical plan, and proactively and fully addressing all of her specific questions and concerns in a focused and unhurried manner. I would clearly communicate this agreed-upon communication plan to Mrs. Rodriguez, emphasizing that while I am, of course, always available to address any genuinely urgent or acutely concerning issues that arise, scheduling a specific, dedicated time for more detailed updates and in-depth question and answer sessions will ultimately allow me to provide her with my undivided attention and ensure I can also efficiently and effectively manage the complex care needs of all my other post-surgical patients on the ward, maintaining safety and optimal care for everyone. In the interim, when approached by Mrs. Rodriguez outside of these scheduled, pre-arranged communication times for non-urgent queries or simply for reassurance, I would provide brief, compassionate, and reassuring updates, offering a few key pieces of information about her father's immediate status, and then politely and gently redirect her to our agreed-upon dedicated communication time, reiterating my commitment to addressing all of her questions fully and comprehensively at that scheduled point in the day. For example, I might say, Mrs. Rodriguez, I understand you have more questions about your father, and I absolutely want to answer them all for you thoroughly and thoughtfully. To make sure I can give you my full attention without any interruptions, and also ensure I can effectively and safely attend to all of my other patients' complex needs at this busy time, let's plan to talk in more detail and go through all of your questions together at agreed time, around 10:30 a.m. How does that sound? In the meantime, please be assured that your father is stable and resting comfortably, and I will of course contact you immediately if there are any urgent changes in his condition before then. Furthermore, recognizing the high level of anxiety and informational needs in this particular situation, particularly given the complexity of a liver resection and the potential for post-operative complications, if Mrs. Rodriguez's anxiety or her need for frequent reassurance and detailed information is exceptionally high or continues to escalate, or if her frequent interruptions, despite the structured communication plan, are still significantly impacting overall ward workflow and potentially compromising patient safety or equitable care delivery, I would proactively and promptly involve other key members of the healthcare team, such as the charge nurse for ward management support, the surgical consultant to directly address complex medical questions and prognosis, the patient liaison nurse to facilitate enhanced family communication and support, or the hospital social worker to provide additional emotional support and coping strategies for Mrs. Rodriguez and her family, to develop a more robust and comprehensive communication and support strategy that effectively addresses Mrs. Rodriguez's understandable needs while simultaneously safeguarding the efficient and equitable delivery of safe and high-quality surgical nursing care to all patients on the ward. This collaborative and multidisciplinary team approach ensures that Mrs. Rodriguez's needs are fully met with empathy and compassion.